And we start off this conversation on men's mental health and their well-being. And I'm joined by three panelists. To my immediate right is Elmad Regan, who is a counseling psychologist and a life coach. Next is the lady is Dr. Mercy Karanja Kibet, who is a psychiatrist at the Mathare National Teaching and Referral Hospital. And last but not least is Dr. Peter Njagi, a psychiatrist and also former chief psychiatrist at Mathare. And I think I'd like to throw this to Dr. Njagi. What is it about men and mental health and seeking care when they have an issue?
Let me first of all get us to understand what we are talking about. When we are talking about mental health, we are not talking about mental disorders. We are starting with a normal person, a person who is mentally healthy. And we look at three areas. They are the feelings of the person. These are actions of the person. And there's also the thoughts, what is going through the mind. If you are thinking proper, if you are acting proper, and if your feelings are appropriate, depends on the condition, you are mentally healthy. I think that's what I call mental health. Now, if there's a problem in that, that's the time you seek help. Otherwise, if you don't have a mental health problem, then you don't need help.
But then one needs to identify that they are at risk or they are having a mental problem to seek help. And we see that men are more often than not unlikely to seek care. Dr. Mercy.
Yes, it's true that men and women all suffer from mental health problems. But you find a lot of time that men they are less likely to seek help or even talk about their mental illness. And therefore, you find that by the time they seek help for their mental illnesses, it's a bit late and complicated and advanced stage. And that is why you find sometimes even the completed suicide rates are higher amongst men than in women. And the same as substance use disorders, because that's a way they find to cope with mental illnesses.
Okay. Elmad, from your work and everyday interaction with people seeking care because of one issue or the other, why is it, or what reasons do you get as to why men do not come, or even when they come, they are probably being forced or brought by force by somebody else? It's more or less involuntary.
Yeah, thank you for having me on set. So in my daily experiences at work, often than not, the people who come to my office are females. And the females who will come will often say that, well, my wife forced me here, or my mom forced me here, or my parents forced me here. And it's because of this stereotype that is there, that men should be strong, should toughen up, should be quote-unquote African. I mean, why should you go for counseling? It's a very Western thing, so it's just a matter of wasting time. And so this stereotype makes the males feel that, well, if so-and-so didn't go for counseling or for therapy as a male, why should I, in my own capacity as a male, go for counseling? I mean, I can go to my boys, hang out, have a few shots, and the problem is sorted. But is it really the case? Because they're suffering in silence and they're not saying it. So if we can debunk the stereotype that men should be strong all the time, then we can get more men accessing mental health services.
Dr. Karanja, do you think it's easy to debunk this stereotype as Elmad is talking about?
There are some cultural and societal expectations, and the roles allocated to the male and the female genders in our society. So you find it's not so easy because the man automatically is expected to be independent, less emotional, less expressive about their feelings, whereas a woman is expected now to be dependent a bit, and they really have these groups and socializations around their female colleagues that allow them to really talk about their feelings. And this gives the women an avenue to sort of get therapy, but men don't. So it's a bit tough because we also have to address the cultural perspective, which is in our country, is quite strong. We have to address the cultural expectations, and also even in our religious bodies, the same way, there's some expectations about a man and a woman.
Dr. Njagi, at what point do men come to seek care when now they have found out that they probably have a mental health problem?
Like my colleagues have said, I totally agree with all of them. Let me first of all say it's not just mental health. where we find women coming out in bigger numbers than men, even in the social occasions, even the church, you find majority of them are women. And we have found actually generally mental illness, like depression, is even commoner in women than men, almost 1 to 2. But the role of the man is basically the head of the house. And he is supposed to provide security and comfort. So the man must be strong. Even women want a strong man. So the way the man is wired, he is supposed to stand very firm and succumb at the last minute. So I think it's good men know. And what I can add about mental illness, quite often you don't know you need assistance. Normally, when somebody comes to see a doctor, they don't come alone. They actually come because they have been coerced, they have been pushed by the people who matter. Even if you come to see me alone, I'll ask you to come with somebody who can tell me something about the historical background so that I can understand the disease. So I think men also need help from the wives, from the women, from the children, to tell them, I think you need help. Dad, where you reach, I think you need help. So let's not just leave to the men to go for help. I think let the society also understand the men, their position, and help
possibly
them.
to agree to help when somebody offers it, because as you said, men live in a society, and if somebody recognizes or points out that could be there's a problem, then I think one of the things is to have men possibly embrace that and be open to seeking care when a problem like that arises. Right? Let's take a question or a comment from the audience.
Okay, thank you. My name is Teyong Ominde, and I would just want to find out, we have seen that generally men would either be forced to seek the medical attention in cases of mental illness, or rather seek this help when it's too late. So are there some kind of red flags that would enable I as a man or the next man to identify that, yes, I have a mental illness or problem and I need to seek help?
Okay, we can start with you, Dr. Karanja.
Yeah, there are certain things that can point to you that indeed you're leaning towards having a mental health complication. And like Dr. Njagi said earlier, mental illnesses affects 3 perspectives: your thoughts, your emotions or your feelings, and your behavior. And sometimes also you find that you're not able to function properly in society. So if you start feeling like you're losing sleep, you're having changes in your appetite, changes in how you relate with people, maybe you don't want to associate with certain people, feeling excessively nervous, that could be pointing towards a depressive illness or an anxiety disorder. But mental illnesses are a variety, so there could also be some that you may not be able to identify yourself, and other people are the ones who tell you, we've noticed like your behavior is a bit different, you're isolating yourself, you used to be a clean person, now we see you've changed a bit, the way you talk, maybe sometimes some people might start feeling excessively energetic, you have too much energy, you don't know where it's coming from, or too low of an energy, and feeling suspicious, feeling like people are following you, people are planning things against you, like you have to look over your shoulder all the time. It could be pointing towards a paranoid kind of a psychotic illness. So there could be several red flags, but start by observing your daily-to-daily activity. Are they being affected? Are you suddenly unable to function as you used to function?
And Elmad,
Yes.
Where should they go to when they see those red flags or those telltale signs, as Dr. Ari has mentioned?
Mm-hmm. Yeah, sure. The good thing is that there is hope and there's assistance which can be found. And so to begin with, it's very, very important for one to see a counselor or a therapist for that reason, so that they're assisted through the process. But then, as we've identified, it's very difficult for men to embrace the concept of counseling. They see it as something very, very outlawed or very out of the norm. Yeah. So for starters, if you asked me, it would be good to first of all confide in a friend and share with them. Now, when I say a friend, it is somebody who means well for you. If they are indeed your friend or a good family relative for that reason, who have your best interests at heart, they'll accompany you for therapy, just as Dr. Peter was saying, because at times it's important when you go for those sessions so that the diagnosis can be made or a case formulated. It's good to be accompanied by somebody who understands you well and means well for you. Yes.
We'll get another question. Yes.
My name is Alan Were, a student at the University of Nairobi, a medical student for that matter. I have to mention with a lot of regret that for my short while in campus, it's unfortunate that all the students we've lost as a result of suicide were all gents, were all males. And in the medical profession, I have to let it be known that doctors might do all their best they can to provide drugs and induce different kind of medication to any patient suffering from anything. But the root cause of a patient healing lies in the brain, how they perceive the disease, and that will affect how they'll be responding to drugs, which unfortunately for the male people, it's different how they take this, because they get into depression and stressed up with all the things around them. So it's a matter that we have to discuss. And one common thing that I have to say that is quite unfortunate is the manner in which people address this is quite alarming. For in this instance, for all these two scenarios I've mentioned, I've had people commenting and actually telling men that, man, you have to be very hard. We need to hit you hard on your nerves and just realize that all these things, all these troubles you're facing in life, they are realities. So you have to harden up, you have to push up and just manage this, which is quite wrong. And you know, other people go to the extent of telling, man, just commit suicide. You know how many people wish for this life to be there. And I have to say that apart from these stress factors and depression that these people are suffering from, if you have a look at the majority when they come out to express their problems, the will to move or the drive to commit suicide is as a result of the feedback that they get from the society. So it's my call to our society and as well our doctors to help us address this.
We started by talking about how to treat or to help these men who are suffering from mental health disorders. And the only permanent way of combating a problem is knowing the cause. Otherwise, you'll be treating the symptoms. And when you treat the symptom, you never get a permanent cure. Normally, we are talking about now suicide being common in men. It has not always been like that. If you go back about 20 years ago, you might find ladies, women were the ones who are committing suicide. And we know how our society has changed. The boy child right now is under a challenge. The boy child is having a problem. So we really need to look at the real cause of this change.
I'd like to hear from you, especially you as the two psychiatrists here. What are the solutions? What is the help that can be given? He's raised a very valid point, because in the recent past, as he has said, there's been suicides in medical school. And is it that we are exerting a lot of pressure on our youth? Because it's not just medical school, but also other youth who are probably looking for jobs or who did not pass the examinations as expected. Are we exerting a lot of pressures on the boys, the men in our society?
Let me start by saying that mental illnesses are not new. They've always been there over time. It's only like maybe the prevalence has increased and there's a bit more of awareness around mental health. That notwithstanding, I think one of the challenges we have as a society is awareness about how to identify somebody who may be suffering, having mental illness. And that is why you've had what the young man asked, why do people encourage somebody to complete suicide because of the stress they are going through? Perhaps the perception is that this is a sign of weakness by those people and they want to dismiss him, or maybe he's just seeking attention. So we need to create awareness in the society so that people can identify people who really are sick. By the time somebody is contemplating suicide, they're actually mentally unwell. And what are what help can you give such a person? Secondly is the issue around stigma about mental health. So most people will not talk about their suffering because they might get stigmatized, or even when they're getting treatment, they will not talk about it. They want to keep it in hiding because of the stigma. So we need to destigmatize mental illnesses. Then, of course, we also need to have people aware of what are the risk factors, who is at risk of developing a mental illness, because there are some things that can actually warn you. If you come from a family where there's a long line of people with mental illness, you need to be aware and put preventive measures that will help you not also, of course, follow the same lineage. There are measures that can be put in place to prevent mental illness, and advocacy and awareness in the society so that we help people before it's too advanced, too late.
And one of the questions I would like to ask, and I'll ask Elmad, is once somebody identifies as somebody has a mental health problem and they need to take them to care, how do you convince or go about asking or getting this person to seek help? Because them cooperating is one of the ways towards healing. Mm-hmm. How do you get them to accept care and help?
Thank you. I think one of the first avenues that we would take as professionals is to get to make the person understand that they have a problem. Because minus that, you'll be more or less pushing the person to seek treatment, while in themselves they don't see the problem at all. And so that's what we mentioned earlier, that it's a question of their behaviors, their thoughts, and their feelings. So if they can be made to understand that the three of these items are not in tandem or in queue, then there is need for help. Yeah. So first of all, making the person understand that, hey, I think this and this is a problem. Do you also feel that way? Now, does that mean that all cases have to go that way? No. There are some which don't follow that channel. Say, for example, if somebody is showing signs of suicide or has injured the other person, in such instances, you don't really have to negotiate with them, because what you need to address first is the problem at hand. This person is suicidal. Okay, so first of all, take them in, they'll be assisted, then after which, slowly through the sessions, they'll be taken to understand that this and this is a problem and needs to be sorted in this or that manner. So very, very key, first thing, make the person understand that this is a problem and needs to be sorted in this or that manner.
Okay. Yeah. Okay, thank you. When we come back, we'll continue with this conversation on men's mental health, where to seek help and possibly the cost of seeking that health care. Is it covered by insurance? Is it covered by NHIF? And in your locality, where do you think you can get, or where can you get that help? In this conversation, I'm with Elmad Regan, Dr. Mercy Karanja, and Dr. Peter Njagi, all professionals in the mental health space. We take a short commercial break.
Men who commit suicide are weak. Myth. Suicide is often a last resort for someone with a mental health issue. About 800,000 people take their own lives yearly. Many more attempt suicide. It was the second leading cause of death among 15 to 29-year-olds globally in 2016.
Thank you for staying with us on Health Digest. With me, Dr. Mercy Karanja, and we're looking at men's health. Before the break, we were talking about how to identify issues of mental health illness in a man, and where to seek help, and what you need to do when somebody is actually like a risk to themselves or a risk to other people. And to start off this second and final segment, we'll take a few questions from our audience here.
Thank you so much. My name is Edna, and thank you for this very informative session. And indeed, mental health is a very critical issue. And when I listen to these discussions, I'm actually thinking, shouldn't it be classified as an NCD, as an uncommunicable disease? Maybe that way it could gain more publicity and more people would be able to come out and seek the medical attention. Also, I would like to ask, what role do you see the family playing? Because at times it's the family members who can actually push their brethren, their brothers or their husbands further away. Maybe they would, the stigma itself could even arise right from the family. So what exactly should the family members do? What role should they play to support their own?
Okay, thank you. We can start with Dr. Njagi. Is mental health an uncommunicable disease?
Mental health is a functional disorder. It is not a communicable disease, but it's functional. We would classify it among other diseases like high blood pressure, diabetes, or even peptic ulcers, where you have this, a lot of acidity. So the body or the mind is not functioning the way it should. What I want to say, because we are going to the next stage of the treatment, there are various stages of mental illness. And the person who committed suicide, like we are even told about the cancer, there are various stages. That is in the final stage. And when you try to help people at the final stage, you may not get very far because it's a bit too late. It's always good in terms of mental health to think in terms of prevention. And you know, prevention is better than cure. Let's not wait until somebody is having a rope and you tell them throw this rope away. What I would like to say is that there's a lot of progress in us, even in Africa, because we have come to accept there's a terminology called stress. If you ask anybody, have you ever had stress? They will tell you, I have had stress. And anybody who has got mental illness has gone through a very stressful period. So during that stressful period, we can actually help these people. The other thing I would say is when mental illness comes in, there is a real chemical change in the body. The way the nerves are functioning, they are affected. And we talk of neurotransmitters in the brain, where the levels go down. And when we give medication, we are able to put this person back. So the treatment of mental illness is twofold: pharmacotherapy and psychotherapy. We have to talk to this person, and we have to help them with a bit of medication when they reach that stage.
Okay. Dr. Karanja, she asked about the role of the family, just before we get to the technicalities of the treatment. What is the role of the family in assisting somebody with a mental health problem?
The family is definitely the first line in terms of prevention and also in the management process of persons who eventually get mentally ill. In prevention, in the sense that providing an avenue where people can express their feelings, an avenue where people can identify when you're going out of the norm and they help you come back online, an avenue where they can be able to identify that this person we live with every day has changed and they need help. And when it is still at the early stages, they can actually either provide the support, talking to people actually sometimes helps reduce the stress levels that may predispose you to a mental illness. But now once a person needs treatment, they're able to identify this person is sick, take them for the help, and support them through the process. Because without the social support, taking the treatment might not be that easy for someone who is mentally unwell.
We had another question.
Thank you very much. My name is Nancy Sironga, and I would like to ask two questions, very brief. Suicide is probably one of the extreme coping mechanism of a person suffering from mental health. I would like maybe to hear more of other ways that people try to cope so that we can understand. And then in terms of access to care, where would you tell people to go and seek for help? Because we know that there are very few places that they can seek for treatment or support. Maybe you could comment on other areas where they can get support.
Yeah, thank you. So people with mental health illnesses will find different ways to cope to their problems or their ailments. And of course, the most extreme one being suicide. But even before they get there, they'll try other venues, say like doing drugs, some engaging in risky behavior, say sexual behavior, extreme sexual risky behaviors. Some would resort to extreme levels of gambling, in as much as they tell us to bet responsibly. We don't have a measure to responsibility, but anyway, all the same, it's still an effect. So such worrying trends, when somebody feels like, okay, I have this problem, but this is my best way of coping, would really raise eyebrows, because if it can't be given a clear-cut line that this is the problem and I should deal with it, say, differently, then becomes a social cycle of addiction, of gambling, of substance abuse. Yeah, because going by the statistics by the World Health Organization, about 800,000 people die annually as a result of suicide, and this is worrying. Yeah, so if you can find alternative methods of coping, and if you ask me, the best way to cope with these issues is to open up about it and go for therapy, other than gravitating towards drug addiction, sexual addictions, gambling, and the likes. It would be easier to tone down these weird coping mechanisms to more healthier ones like therapy?
The family, like you said, is almost everything actually, because the family actually can even contribute to the mental illness. You know, they are what we call family dynamics. There's a lot of strained or skewed relationships between man and wife. And there's even comorbidity or enabling. You could be part of the problem. So it's always good actually if you are dealing with a person, look at the family also, because the family could be contributing.
Yeah.
And even when this man is recovering, it is the same family which will help him to recover. So I think let's not separate the man from his family. Let's look at the family and the family dynamics.
So the second question, Dr. Karanja, was where do people access help when they have a mental health problem?
When it comes to mental health, support to maintaining that mental health should actually start at the family level, community level, because this is where now, unfortunately, men don't have these opportunities. Like I said earlier, women will have these groups where they talk to each other, they release their stress, their emotions. But you find that men, they will probably do that in the pub or something like that. But there are some other things that you can do that are preventive, like participating in sports. But in the primary health facilities, we should even be able to find things like counseling. Yeah? When you're feeling a bit unwell, you can just go and speak to a healthcare provider, and just even brief counseling, what we call brief intervention, can go a long way in helping somebody improve their mental health before even graduates to a counseling psychologist. Not everybody who has a mental health problem requires medication. Some majority will actually just need psychotherapy when the condition is not very complicated. And this psychotherapy, this counseling is available at different health facility levels. And now it becomes severe, where it needs now medication hospitalization, we have both general hospitals, specialized hospitals that offer that, specialists who are in private practice and general practice, and they're accessible. It's just that people shy away from seeking this help because earlier what we said, feeling like it's a weakness.
Based on the professional counselors, marriage counselors, and the primary healthcare facilities where counseling is done, men rarely turn up for these services. Kindly clear the assumption that you'll find a very nagging woman leading a man into, let's say, hitting her, domestic violence. Is it that assumption that we have several women in mental facilities and several men in the prisons?
Quite an interesting question, and very, very emotive as well. Yeah, so it's still a challenge to get men to access mental health services. And see, even the example she's giving, assuming you have a nagging woman who drags the husband all the way to the therapy room that you must be cancelled and stuff like that. You see, that already injures the ego of a man, because genetically how a man is wired up. They want to be this protector, as Dr. Peter earlier said. They want to be this exemplar or figure to everybody. But then here they're being told that you're the problem, you must go. They'll feel like, I'm only being forced to do this. Yeah? And so the moment they get there, they'll feel like, no, this is out. I can't cope with it. Yeah? But if they are indeed spoken with effectively, and I underline the word effectively, then they won't resist. Because slowly by slowly they'll start accessing health services. And that gives the dynamics that we have. Like, say, for example, in Africa and in the Western countries, where the concept of therapy is very much welcome. Whether you're male or female, so long as you have a problem, you have to go and seek it. So if you can change that narrative by effectively communicating with the persons affected, then it becomes easier. Because in the broader perspective, even the family members are equally affected. It's not just the individual who has the problem. When the man is unwell mentally, the entire family is sick. But until he gets well, then can the family be restored back to its former glory?
A final question.
All right, thank you. Okoth Onyango from the University of Nairobi School of Medicine and the Vice Chairperson, Kenya Healthcare Student Summit. Now, my question is as regards the Kenya mental health policy. From the World Health Assembly, I think at the 66th session, resolution number 8, countries were urged to have, mental health policies, and Kenya, we developed one running from 2015 to 2030. And, we have seen, from where I stand, I see, like a slow adoption of that policy, because among the factors that were, that were listed, as primary indicators to in this policy was the issue of, financing of healthcare treatment, the personnel, the human resource, as well as the social support. But we have not seen this being effected well in institutions, as well as even government offices. I met a case of a student who was referred to a counselor in their campus, but they could not find a counselor because the counselor was on leave. I mean, what is it that is lacking in the adoption of this policy in our institutions? Thank you.
Okay. Dr. Karanja, very briefly.
I think as a country, we are moving in the right direction in terms of addressing mental health issues. Like he mentioned, there's already a mental health policy. The implementation might seem to be slow, but I believe there's also a consideration even currently in the universal health coverage that's happening. So we should see more progress in the variety of services in mental health provided. Okay.
We definitely have a long way to go in addressing mental health issues, and I'd like to get your final brief comments on the issue of addressing men's mental health and well-being. And I'll start with you, Dr. Njagi, just very briefly.
I believe we are making progress, but I believe the health department by our government has not been placed where it is supposed to be, because you see, a country means the people, and the health of the people is very important. When you look at the budget the Minister of Health gets compared to even education of the armed forces, it is peanuts. I think we need more input from the government, and the political climate needs to look at the health of people in general and do more financing. I think that is important.
Dr. Karanja, final comments?
Mental health for men is very critical, and we should focus not just on waiting for treatment. We should start focusing on prevention, and then from prevention and promotion of mental illness from the community level, and then when they seek treatment, also we encourage the families to be supportive, and we stop this stereotyping men that they should not fall mentally ill. They are humans, they are vulnerable, but let's support them to have mental health.
Your final comments?
Yeah, I'd urge every stakeholder to come on board and assist in the fight against mental health and the stereotypes around it, so that there is assistance. And so what is necessary is to understand that we need to accept that it's a real problem that exists and it needs to be handled or tackled. Then two, we need to understand the dynamics around it. And eventually, for the ones affected, we need to help them either open up or address them to more easy avenues of getting the assistance. And eventually, even for the government, they should fast track the implementation of the policy, Kenya Mental Health Policy, as he mentioned, because it lies among the 54 countries in Africa which are yet to adopt a separate health budget for matters of mental health. So if that is done from the community level, as Dr. Karanja mentioned, to the government, then eventually you'll see a change in the dynamics.
Okay.
Yeah.
Thank you, ladies and gentlemen, and our audience for this conversation on men's mental health. We're looking at issues around men's health, particularly mental health and their health-seeking behavior, and where help is available. And I think what the panelists have insisted on is that at the core is a family unit, which is the first line of care. And thank you very much, Elmad Regan, who is a counseling psychologist and a life coach, Dr. Mercy Karanja Kibet, who is a psychiatrist at Mathare National Teaching and Referral Hospital, and last but not least, Dr. Peter Njagi, who is also a psychiatrist and former chief psychiatrist at Mathare.